I'm Jordan Bonier, DO. I am a total joint, hip, and knee surgeon. I also do general orthopedics, which involves shoulder. So we'll talk about some common injuries related to the shoulder in sport. So first one I'm going to talk about here is rotator cuff tears. So what is the rotator cuff? Rotator cuff is a group of four muscles and their tendons, and it stabilizes the ball and socket joint of the shoulder. So it allows for a very wide range of motion in the shoulder compared to other joints in our body. So this is one of the most common shoulder injuries in athletes, and typically it's going to involve sports that have repetitive overhead motions, typically baseball, with throwing athletes, tennis, swimming. So how does the injury occur? There's several different mechanisms. Acute injuries are typically more traumatic, and that's falling on an outstretched hand or falling directly onto the shoulder itself. The more common type of rotator cuff tear that I see in my practice is more chronic wear and tear over time. I refer to this as a degenerative rotator cuff tear. The symptoms associated with a rotator cuff tear are often pain, sometimes weakness, limited range of motion, particularly with raising the arm overhead, reaching behind the back. Patients will oftentimes describe difficulties with reaching up into a shelf or washing their hair, reaching behind their back to put on a bra strap. So those types of things are typically raise a red flag for potentially having a rotator cuff tear. So the treatment almost always starts with non-surgical treatment, particularly in those tears that are the more chronic wear and tear type tears. So, this is often effective for the partial tears. When we describe rotator cuff tears, we talk about partial tears versus full thickness tears, where the tendon is actually completely torn off of the bone. And those types of tears will typically present more with more profound weakness and oftentimes more pain. The partial tears, where only part of the fibers are torn off of the bone, and the less severe injuries oftentimes are more amenable to non-surgical treatment. So the mainstay of non-surgical treatment for rotator cuff tear is physical therapy, and that focuses on strengthening of the muscles that surround the shoulder and improving range of motion, anti-inflammatory medications to help with the pain, and then injections also to help with the pain. And typically these are cortisone injections, which is an anti-inflammatory medication as well. But sometimes we use other alternative types of injections. And typically in my practice, we do a fair amount of platelet-rich plasma, which is a regenerative type of biologic injection that has some good results with rotator cuff injuries. So um, that typically is the course of non-surgical treatment that we'll attempt for usually at a minimum of 4 to 6 weeks. In those cases where the tear is large, which we talked about full thickness tear, the patient has profound weakness, or just non-surgical treatments aren't effective and they continue to struggle with pain and weakness, that's when we start to think about doing surgery for rotator cuff tears. And typically, rotator cuff tears are treated with repair of the torn tendon. So the tendon itself is brought back down to the bone, usually with anchors. And the anchors have sutures that are attached to them that we stitch the tendon back down to the bone. This can either be done arthroscopically, which is the way that I typically do it, through the use of a scope, where it's a more minimally invasive type of procedure where we make small incisions and put a camera into the joint and take a look around and diagnose the issue. And then through other small little incisions, we can take instruments and repair the tendon. Alternatively, it can be done with an open repair, which is a standard, more invasive incision if the tendon is a larger tear. Shoulder dislocation. So this is essentially the ball of the shoulder joint pops out of the shoulder socket. And so because the shoulder is the body's most mobile joint, it makes it more susceptible to dislocations than other joints in our body that are more of the hinge type joints, like the knee and the elbow. So, because of its greater range of motion, it's more susceptible to dislocation. This type of injury is common in contact sports. So this will be, football, rugby, hockey, any of those types of sports that involve direct hits to the shoulder. And so that's typically how this occurs, is a sudden impact or fall, especially when the arm is in an awkward position. It can happen with falling on an outstretched arm. And the symptoms are usually an intense, immediate pain, a visible deformity. So you can visibly see that the ball does not look like it's located into the socket. And then a complete inability to move the shoulder. So this is typically treated immediately with what's called a reduction. So what that means is that a healthcare professional will manipulate the shoulder back into place. So it's literally taking the ball and pushing it back to where it belongs next to the socket. So usually this has to be done in a healthcare setting. So typically in an emergency department where medication can be administered to relax the shoulder muscles and allow for more ease and a safer reduction maneuver. But sometimes the shoulder will self-reduce when the athlete is on the field, or if the athlete's used to having recurrent dislocations, sometimes they can reduce the shoulder themselves. But typically, this will be done in a healthcare setting. And then after reduction, after the shoulder's put back into place, a sling will be used for immobilization. The next step in treating a shoulder dislocation is rehabilitation. And really, this will focus on strengthening exercises to prevent future dislocations. And so typically that's done for about 4 to 6 weeks, sometimes longer, and with gradual return to motion. Surgery is sometimes indicated, and usually that's if the joint remains unstable. So if there is a recurrent dislocation, or if it's a first-time dislocator in a younger athlete, sometimes we will consider surgery. And typically, when a shoulder dislocation happens, there can be damage to a structure called the labrum, which is a cartilage ring that surrounds the socket of the shoulder joint. And it somewhat acts like a bumper and increases the surface area of the joint. And so when the ball pops out of the socket, sometimes you can get damage to that labrum, and oftentimes damage even to the bone of the socket. So the surgical treatment is oftentimes directed at repairing this labrum or the bone and the labrum complex. Other type of stabilization procedures do exist to try and increase the stability of the shoulder in those people who do have recurrent dislocations. Last one, we're going to talk about is shoulder impingement syndrome. And this is probably the most common type of shoulder issue that I see in my practice, whether related to sport or not related to sport. And essentially, what this is the tendons of the rotator cuff become irritated and inflamed as they pass through a space that's called the subacromial space. So this is a small space where the rotator cuff tendons sit underneath a bone called the acromion, which is part of the shoulder blade. And if you touch the top of your shoulder and you feel the bony prominence, that's known as the acromion. And right beneath that are the rotator cuff tendons. So this will be common in sports with repetitive overhead activities such as swimming, tennis, volleyball, golf, those types of activities where the rotator cuff is brought into close contact with the acromion. So repetitive overhead motions cause the tendons to rub against the acromion, or this bone related to the shoulder blade, which leads to inflammation and pain. And so the symptoms typically will involve pain when lifting the arm, and particularly when reaching overhead. And sometimes in the case where we do start to see some more severe impingement syndrome, we can start to get some tears of the rotator cuff. And in those cases, that's when we'll start to see some weakness in the shoulder. So the treatment for this mainstay, just like the rotator cuff pathology, is non-surgical to begin. So typically this involves physical therapy, which is aimed at improving the shoulder mechanics. So we want to strengthen the muscles that surround the shoulder and the shoulder blade to try and improve the mechanics of the shoulder and prevent that chronic impingement that happens with overhead motions. Anti-inflammatory medications can be a great adjunct to try and reduce the pain that's associated with the inflammation in the tendons. And on the same regard, injections can help with that as well. And typically, as we were discussing with rotator cuff injuries, cortisone injections are the mainstay of treatment, which is an anti-inflammatory medication. But also in my practice, I do utilize biologic injections such as platelet-rich plasma. In those cases where symptoms persist despite non-surgical treatment, which really I like to see at least 6 weeks of non-surgical treatment before I consider doing surgery for this type of condition. But if these symptoms do persist, then you can consider surgery. And typically this is done, at least in my hands, with arthroscopic surgery, where we attempt to create more space for the rotator cuff tendons when you lift up the arm. So essentially what we're doing is focusing on trying to remove bone spurs that sit right above the rotator cuff and removing some of that inflammatory tissue that develops in what's known as the bursa, which is a little fluid-filled cushioning sac that sits between the bone and the tendons. And so you can go in there with a camera and take a look and diagnose the problem in the joint, and then take instruments through arthroscopic portal incisions, which are usually about 1 centimeter big, and clean out bone spurs and clean out the bursa inflammatory tissue to try and increase the space for the rotator cuff tendons. And this typically will resolve the problem. And there's a quicker return to activity and sport with this. Occasionally I see patients back after this type of surgery in 2 weeks. We take out their stitches in the office and they've got full range of motion and no pain. So this is typically a quicker recovery than a rotator cuff repair, which we're more looking at sometimes 3 to 6 months of recovery, depending on the size of the tear.